Hi guys, I'm James. I'm the exercise physiologist here at Timboon District Healthcare Service. So we're here in Tradies Health Month, just giving a few tips and tricks on how to begin an exercise program, why to begin, or maybe give people a bit of an idea of where they should start. So I'm going to run through 4 quick things to think about when we're working in a trade that we should think about when we're potentially starting an exercise program, returning to a job site after an injury, you know, anything like that, anything that involves in getting back into some form of regular exercise or activity. So first tip, we want to try and think of having a strong core. So a lot of the time, if we quizzed anyone on a job site, what are the most likely things to experience in terms of injury? It's mainly back pain, neck pain, aches and pains that go along with repetition, crawling, digging, those sorts of activities. So we want to try and take care of our core. So if we think strong core, strong muscles, stronger joints, better function and better movement. So what we want to try and make sure of is that you're doing some form of core work fairly consistently in any sort of exercise program. Now that doesn't necessarily mean crunches or those types of activity. Any sort of lifting exercise is going to have some form of core involvement in it. We really want to try and make sure that we focus on that as much as we're able to, or at least every session. Number 2, it's not about being the strongest. We want to try and focus on muscular endurance. So a lot of the time I'll see people will come in and see someone like myself, and the injuries have come about through repetitive moving or repetitive twisting or something like that. We want to try and train our muscles to be able to handle that. If we can lift something really heavy once, that's all well and good, but if we can't do it 50 times without causing ourselves injury or an ache or a pain, obviously that's going to be a problem. So really think about trying to have some form of consistent circuit training that focuses on a whole different group of muscle groups. It doesn't necessarily need to be in a gym lifting weights. It could be something as simple as squats, push-ups, those types of activities, and training your muscles to handle repetitive load. Number 3, don't forget cardio. So that doesn't necessarily mean running on a treadmill or anything like that. You don't have to be doing things that you don't enjoy doing. It might be something as simple as playing football. It might be as simple as running around with the kids in the park. Could be boxing, punching a bag in the garage. Anything where you're getting yourself to huff and puff. If you can talk like I'm talking at the moment, you're probably not working hard enough. We want to try and get ourselves to the point where we need to take a few big deep breaths in between words. So anything to that intensity is going to be really helpful. Tip number 4 for getting back into an exercise program or returning to work, it's don't ignore the warning signs. If we go onto a job site, there's potential dangers everywhere. There's lifting hazards, there's all sorts of different things going on. Your body's going to give you those warning signs as well. So look out for things like aches and pains, early warning signs of an injury. Chest pain, dizziness, muscle aches and pains, numbness, could be anything. Take note of those. Be aware of what's occurring and when it's occurring. If you do experience anything like that, see some form of trained professional. That might be myself, an exercise physiologist, or it could be a physiotherapist. You can access those services here at Timboon District Healthcare every day. Thanks guys, thanks for listening, and good luck.